everyone, and welcome back to the channel. Today, we need to talk about some serious public health news coming out of Ethiopia. The Ministry of Health has just confirmed an outbreak of hemorrhagic fever in Jinka town, which is in the South Ethiopia regional state. This is a developing situation, so let's break down what we know so far, what's being done, and what you need to look out for. According to an official statement released this past Wednesday, health authorities have identified 8 suspected cases. This is what's known as an initial cluster. And it's prompted an immediate and robust response. The Ministry of Health hasn't wasted any time. They've already deployed a rapid response team directly to Jinka. This team has a few critical missions. First, to figure out the exact cause of this outbreak. Second, to conduct thorough laboratory testing on samples from the suspected cases. And third, and most importantly, to put measures in place to prevent this from spreading any further. Now, you might be wondering, what exactly is hemorrhagic fever? It's not one single disease. It's a term for a group of illnesses caused by several different families of viruses. Some names you might recognize are Ebola and Marburg, but there are others like Lassa fever and Crimean Congo hemorrhagic fever. What they all have in common is that they can damage your blood vessels, making them leaky, which can lead to the hemorrhagic or bleeding symptoms that give them their name. These viruses are often found in animals or insects, and humans can get infected through contact with these infected hosts or through contact with an infected person's bodily fluids. The key thing to understand right now is that the specific type of virus causing this outbreak in Jinka has not yet been confirmed. Samples are currently being analyzed in a lab, and identifying the exact virus is a top priority because it dictates the specific treatment and containment strategies. The Ministry of Health has assured the public that they will provide updates as soon as these lab results are available. In the meantime, the response on the ground is being described as a coordinated effort. The ministry is working closely with its partners. They're not just waiting for sick people to show up at clinics. They are actively engaged in community-level monitoring. This means they have teams going out, tracing the contacts of the 8 suspected cases to see who they've been in close proximity with. They're also conducting house-to-house case finding, which is a proactive way to find people who might be sick but haven't sought medical care yet. This intensive surveillance is crucial for getting a handle on the true scale of the situation and for breaking the chains of transmission early. So, what should residents in and around the Jinka area be doing? The ministry has issued clear advice. If you or someone you know starts experiencing symptoms like unexplained bleeding, this could be from the nose, gums, or anywhere else, a high fever, severe diarrhea, or vomiting, you need to seek medical attention immediately. Don't wait. Early diagnosis and supportive care are vital for a better outcome with these types of illnesses. The ministry is also hammering home the importance of public vigilance and good hygiene. This is our first line of defense. They are strongly urging everyone to maintain strict hygiene practices. This means washing your hands regularly and thoroughly with soap and water. It also means avoiding close physical contact with anyone who is showing these symptoms. This isn't about creating panic or stigma. It's a practical and necessary step to protect yourself and your community. Beyond the public, there are also directives for healthcare providers. All health facilities throughout the region have been put on high alert. They've been instructed to strengthen their patient screening protocols. So, when anyone comes in, they'll be asked specific questions and checked for symptoms. They've also been told to immediately isolate anyone who is a suspected case to prevent any spread within the hospital or clinic itself. And, of course, they have a duty to promptly report any new potential infections to the central health authorities. This creates a tight information loop that allows the rapid response team to react quickly to new developments. This is a serious situation, But it's important to recognize that the Ethiopian health authorities are taking it very seriously. They are following established protocols for outbreak response. The deployment of a rapid response team, the contact tracing, the public health messaging, these are all the right steps. For now, the best thing we can all do is stay informed through official sources, like the Ministry of Health, and avoid spreading rumors or unverified information, which can often cause more harm than good. We'll be keeping a very close eye on this story, and we'll bring you updates as soon as the laboratory results are released and we know more about the specific virus. Thank you for watching. Please stay safe, look out for one another, and follow the guidance from health officials. If you found this update helpful, please give it a thumbs up and subscribe to the channel for more important news. We'll see you in the next video.